So here's something that I just had in my office pretty recently. It's a patient who came in and, like a lot of patients, older, hadn't been to the dentist, was starting to get cavities on a lot of his teeth. And it was to the point where it was not cost effective to try to save the teeth because, in all honesty, there was not much left you could save. So we had to go to the next best option, which was replacing the teeth with implants. So what we did for him, we were able to save his lower teeth. We cleaned them up. We actually did some periodontal treatment on him, some LANAP on him to actually get his gums healthy on the lowers. And then we were able to replace his upper teeth with a nice new smile for him. And he went from basically this smile right here to something that's actually a whole lot more aesthetic for him. And it's a whole lot more functional too, because he can actually chew, he can actually eat. We were able to replace the back teeth as well, because he had already been missing those for quite some time. That we were able to get him periodontally healthy and also able to get him restoratively healthy too, so he actually had some teeth to chew with.
In these cases, how do you keep them nice and comfortable during those 3 to 4 hours?
IV sedation is the go-to. That way, you put them to sleep there, so they're nice and sleepy. You end up doing it, and honestly, they don't remember anything. You're just calm, cool, relaxed through the whole procedure.
They don't even know that anything happened. They wake up, it's done.
Yeah.